New York City's vaccine mandate for healthcare workers goes into effect tonight, but
hold up, wait a minute.
First, here's why this is potentially a big deal. That mandate essentially requires more than 665,000 healthcare workers from public and private hospitals as well as nursing homes to get vaccinated. While many states including Connecticut and California are beginning to implement mandates like this, New York City is a little bit different.
I'm built different.
It's different because it doesn't allow for workers to opt for testing regularly instead of being vaccinated. And this basically means that these healthcare workers have until the end of today to get their first dose of the vaccine, and if they don't, they can't work tomorrow. The executive director of the Greater New York Healthcare Facilities Association stated, quote, "We're anticipating a problem," end quote. And that seems to be the common assumption right now. It seems that New York nursing homes are already experiencing disruptions, with some beginning to not even accept new admissions. Along with that, according to the New York State Department, only around 87% of nursing home employees had received at least one dose of the vaccine as of this weekend. Now, if you follow the news closely, you've probably heard that a federal judge has temporarily blocked requirements which are similar to this for New York City public schools. And this has some people confused because no such ruling has been made for healthcare workers. But in New York, some lawsuits have been filed by healthcare workers which are backed by unions that are currently pending in the court systems, but they just haven't delivered a stop to the mandate. Perhaps the most interesting and amazing part of this whole vaccine mandate is the governor of New York's response and solution to cover the positions which will soon be vacant. At this time, I'm aware of several options that have been outlined. One of them is to activate the National Guard to cover staff shortages. While I'm not really sure what exactly that entails, another outlined solution is to declare an emergency that would essentially allow for providers who are licensed in different states or even countries to practice in New York State. It would allow for recent graduate or retired healthcare workers to do the same as well. Thanks so much for watching. If you enjoyed this news story breakdown, feel free to leave a like or maybe even subscribe.